Hello everyone. Today, our focus will be on the art of capturing a flawless, all-encompassing health history from adult patients, an immensely significant topic within the realm of clinical practice. As you know, diagnosis in medicine rests upon three fundamental pillars: clinical history, physical examination, and investigations. Surprisingly, approximately 70% of diagnoses can be derived solely from a thorough examination of the patient's history, underscoring the paramount importance of mastering this skill. With this in mind, let us embark on this enlightening journey. What is history taking? The general history taking of a patient is an essential part of the medical evaluation process. It involves gathering information about the patient's medical, social, and personal background to understand their overall health status, formulating a diagnosis, providing medical care to the patient. Importance of taking clear history. Accurate history is the critical first step to determine patient's illness. Understanding the patient's experience of illness by taking a history is central to the practice of all branches of medicine. History, combined with physical examination, serves as the initial step in understanding why a patient sought medical attention. This process necessitates patience, attentiveness, and empathy to gather crucial information that leads to accurate diagnosis and appropriate treatment. Ideally, an ideal scenario involves a calm and articulate patient who can effectively describe the sequence and characteristics of their symptoms in a chronological order, while also addressing supplementary questions to provide additional details and clarity. Remarkably, a significant portion of the time, a diagnosis can be established solely based on the information obtained from the patient's history. Beginning the consultation. Before starting the consultation, it is important to review the patient's past records, including any referral or transfer correspondence. This allows for a comprehensive understanding of the patient's medical history and provides valuable information for the current evaluation. Familiarizing oneself with these records establishes context and facilitates a more informed discussion with the patient. It also ensures continuity of care and reduces the chance of overlooking important details. Taking the time to review these documents demonstrates a proactive approach to delivering high-quality healthcare and enhances the effectiveness of the consultation process. How to take a history. The basis of true history is good communication between doctor-patient. As Sir William Osler said, "Always listen to the patient. They themselves might be telling you the diagnosis." To approach taking a history effectively, consider the following key points. Professional appearance. As a doctor, it is important to present yourself in a manner that reflects your professionalism and inspires confidence. Allocate sufficient time, allow ample time for the patient, creating an environment where they feel comfortable sharing their concerns. Avoid rushing, as it can hinder the patient's willingness to provide complete information. Introduction and name confirmation. Introduce yourself and anyone accompanying you. Confirm the patient's name and address them as they prefer, taking into account cultural norms and the preferences of older individuals. Attentiveness. Be fully present and attentive during the patient encounter. Minimize distractions and interruptions, ensuring that your focus is solely on the patient's needs. Informed consent. Prior to initiating the history-taking process, ensure that the patient has given their informed consent. Privacy and dignity. Respect the patient's privacy and maintain their dignity throughout the encounter. Provide a private setting and address sensitive topics with sensitivity and discretion. Patient comfort. Make the patient as comfortable as possible, both physically and emotionally. Consider their comfort when positioning them and provide any necessary support or accommodations. Summarize and clarify. Recap and summarize the information obtained at each stage of the history-taking process. This helps ensure accuracy and allows the patient to correct any misconceptions. Patient involvement. Involve the patient actively in the history-taking process. Avoid solely relying on information provided by relatives or caregivers, as the patient's own perspective is crucial for an accurate assessment. By following these guidelines, healthcare professionals can establish rapport, foster open communication, and gather a comprehensive history that contributes to effective patient care. The questioning style used during a patient consultation is crucial for establishing rapport and effective communication. Here are some key points to consider. Begin with open-ended questions that encourage the patient to share their concerns and needs. For example, asking "How can I help you today?" allows the patient to express themselves freely. Actively listen to the patient and show genuine interest through attentive body language and encouraging comments. This helps create a supportive and comfortable environment for the patient to share their thoughts and feelings. Give the impression that you have ample time for the patient. This conveys respect and attentiveness, making the patient feel valued and heard. Allow the patient to tell their story in their own words, without unnecessary interruptions. This allows for a comprehensive understanding of their situation and helps build trust. Occasionally, summarize what the patient has said to ensure accurate understanding. By restating their thoughts and asking if your interpretation is correct, you demonstrate active listening and validate their experiences. Pay attention to the way you ask questions. Use a compassionate and non-judgmental tone, avoiding leading or suggestive questions that may influence the patient's responses. By employing a patient-centered questioning style, healthcare professionals can establish a positive rapport, enhance communication, and gain a better understanding of the patient's needs and concerns. When questioning patients during a consultation, there are two main types of questions: open questions and closed questions. Open questions are general and allow patients to provide more detailed and personalized responses. These questions invite patients to talk freely without anticipating specific answers. For example, asking "Could you please tell me more about the cough?" gives the patient the opportunity to provide a comprehensive description of their symptoms. Closed questions, on the other hand, seek specific information and are used for clarification or obtaining precise details. These questions typically require a brief or specific response, often a yes or no answer. For example, asking "Are you coughing to try to clear something from your chest, or does it come without warning?" is a closed question that seeks clarification about the nature of the cough. Closed questions can also be used to gather specific information, such as asking about the color of sputum. These questions are useful when precise details are necessary for diagnosis or treatment. Components of the comprehensive health history are listed here. We will discuss each component now. Identifying data source of the history. These include age, gender, marital status, and occupation. The source of history or referral can be the patient, a family member or friend, an officer, a consultant, or the clinical record. Document the relevant information. Chief complaints are the specific symptoms or concerns that lead a patient to seek medical care. It is important to accurately quote the patient's own words when documenting their chief complaints. By doing so, healthcare professionals can gain insight into the patient's perspective and better understand their primary concerns. For instance, a patient may express their chief complaint as "My stomach hurts and I feel awful." Quoting the patient's exact words helps capture the nature and severity of their symptoms. In cases where patients do not have specific complaints, it is essential to note their reason for the visit. This could be a routine checkup or a request for a comprehensive evaluation of a specific condition, such as a heart examination. By documenting chief complaints in the patient's own words, healthcare professionals can accurately represent their concerns, which aids in making an appropriate diagnosis and providing targeted medical care. Present illness. This amplifies the chief complaint, means it describes how each symptom developed and also includes patient's thoughts and feelings about the illness. Each principal symptom should be well characterized. Site, onset, character, radiation, associated symptoms, timing, exacerbating relieving factors, severity. In medical practice, it is important to clarify the terms used by patients to avoid misdiagnosis or misunderstanding. Here are some common terms that often require clarification. Allergy. While true allergies involve an immunoglobulin E-mediated reaction, patients may use this term to describe intolerance to certain foods or drugs, often accompanied by gastrointestinal symptoms. To differentiate, healthcare professionals should look for visible rash, swelling, or a history of rapid onset symptoms. Indigestion. This term can encompass various conditions such as acid reflux with esophagitis, peptic ulcer, gastritis, or cholecystitis. To gain clarity, Inquire about symptoms like retrosternal burning, acid taste, and the site and nature of discomfort. Joint pain, muscle pain, immobility. Patients may mistakenly refer to muscle pain or immobility resulting from prior skeletal injuries as arthritis. To determine the correct diagnosis, healthcare professionals should look for additional signs such as redness or swelling of joints, muscle tenderness, and deformity at the site. Other common terms, catarrh, fits, and dizziness are terms that patients may use to describe various symptoms. It is essential to delve deeper into the specific symptoms experienced by the patient to gain a clearer understanding of the underlying condition. By clarifying these terms and exploring the associated symptoms in detail, healthcare professionals can ensure accurate diagnosis and provide appropriate medical care to patients. After the patient has talked about his chief complaints, ask the systemic questions related to the symptoms in order to rule out differential diagnosis. If you suspect cardiovascular problem, you can ask, do you ever have chest pain or tightness? To differentiate angina, acute coronary syndrome, esophagitis, or esophageal spasm. Other than this, you can ask, do you ever wake up during the night feeling short of breath? Or have you ever noticed your heart racing? If your complaints match with respiratory or gastrointestinal problems, inquire about related issues. If the complaints are related to genitourinary, musculoskeletal, endocrine, and neurological problems, you can ask the following related questions to gather more information. When taking a patient's history, it is crucial to understand the typical patterns of symptoms associated with different conditions. Infections often have a sudden onset, with rapid progression and symptoms like fevers, rigors, and localized manifestations. Inflammation, on the other hand, can be more variable, fluctuating over time and affecting multiple areas of the body, accompanied by local tenderness. Metabolic symptoms can have a wide range of onset and progression but generally show a steady increase in severity without remission. Malignant diseases tend to have a gradual and insidious onset, progressing steadily over weeks to months, with symptoms such as weight loss and fatigue. Recognizing these characteristic patterns allows healthcare professionals to provide comprehensive care and timely interventions for their patients. Distinctive patterns of symptom onset and progression are observed in different disease categories. In toxic diseases, symptoms emerge suddenly and escalate rapidly, often accompanied by a dramatic onset and the presence of vomiting as a common symptom. Trauma-related symptoms appear suddenly, with minimal changes in their progression over time, often leading to clear diagnostic indications based on the patient's history. Vascular diseases demonstrate a sudden onset and a stepwise progression characterized by acute episodes, with physical signs swiftly developing. Degenerative diseases, on the other hand, exhibit a gradual onset, with symptoms worsening gradually over months to years, occasionally experiencing periods of more acute deterioration. Recognizing these patterns enables healthcare professionals to accurately assess and diagnose various conditions, facilitating the implementation of appropriate care and interventions. Past history. The past medical history of a patient can provide valuable insights into their current symptoms and potentially reveal any pre-existing or underlying conditions. It encompasses both childhood illnesses and adult illnesses across various medical domains. Childhood illnesses. This category includes diseases such as measles, rubella, mumps, whooping cough, chickenpox, rheumatic fever, scarlet fever, and polio. Additionally, any chronic illnesses experienced during childhood should be noted. Adult illnesses. The adult medical history should focus on illnesses within each of the following areas. Medical history. Information pertaining to illnesses such as diabetes, hypertension, hepatitis, asthma, and HIV. Other relevant details include previous hospitalizations, the number and gender of sexual partners, and risk-taking sexual practices. Surgical history. The surgical history should encompass the dates, indications, and types of operations the patient has undergone. Gynecology and obstetrics history. Inquiring about the gynecology and obstetrics history involves gathering information about previous pregnancies, childbirth experiences, menstrual history, methods of contraception used, and the patient's sexual function. Psychiatric history. It is important to explore the patient's psychiatric history, including details about past illnesses, the timeframe of the conditions, specific diagnoses, previous hospitalizations, and treatments received. By considering the comprehensive past medical history, healthcare professionals can gain valuable insights into a patient's health background, aiding in the understanding and management of their current condition. Drug history. It is crucial to document the details of medications, including their names, dosages, routes of administration, and frequency of use. Additionally, inquire about the use of home remedies, over-the-counter drugs, dietary supplements, oral contraceptives, and medications borrowed from others. Request patients to bring all their medications for a comprehensive review. When discussing medications, don't overlook inhalers and topical treatments, as patients may assume that the focus is solely on oral tablets. Concordance and adherence play integral roles in patient care. Concordance emphasizes the importance of shared decision-making and patient involvement in treatment choices, while adherence refers to patients following the agreed-upon treatment plan, including medication compliance. Both concepts significantly impact healthcare outcomes and patient well-being. Inquire about any drug allergies or previous adverse reactions. Patients should be asked if they have ever experienced an allergic reaction to a medication or vaccine. For individuals who have had severe or life-threatening allergic reactions, it is advisable to recommend wearing an alert necklace or bracelet. In regards to health maintenance, it is important to address specific areas such as immunizations and screening tests. Regarding immunizations, inquire about the patient's vaccination history for tetanus, pertussis, diphtheria, polio, measles, rubella, mumps, influenza, varicella, hepatitis B virus, HBV, human papillomavirus, HPV, meningococcal disease, Haemophilus type B, pneumococci, and herpes zoster. For screening tests, discuss tuberculin tests, pap smears, mammograms, stool tests for occult blood, colonoscopy, and cholesterol tests. It is essential to gather information about the results of these tests and when they were last performed. If the patient is unsure of this information, written consent may be required to obtain previous clinical records. Family history. When obtaining a patient's family history, it is important to gather information about their immediate relatives, including parents, grandparents, siblings, children, and grandchildren. Create an outline or diagram indicating the age and health status, or age and cause of death, for each relative. Review the presence or absence of specific conditions within the family, such as hypertension, coronary artery disease, elevated cholesterol levels, stroke, diabetes, thyroid or renal disease, arthritis, tuberculosis, asthma or lung disease, headache, seizure disorder, mental illness, suicide, substance abuse, allergies, and any symptoms reported by the patient. Inquire about any history of breast, ovarian, colon, or prostate cancer in the family. Additionally, ask about the presence of any genetically transmitted diseases or conditions. Gathering this comprehensive family history helps in assessing potential genetic predispositions and providing appropriate healthcare recommendations. Personal social history. The personal and social history section gathers information about the patient's personality, interests, support system, coping mechanisms, strengths, and concerns. It covers various aspects such as occupation and education, living situation, significant relationships, sources of stress, important life experiences, leisure activities, religious beliefs, and daily activities. Smoking. Tobacco use carries multiple health risks, including obstructive lung disease, cardiovascular problems, peptic ulcers, growth restrictions during pregnancy, erectile dysfunction, and various types of cancers. Sensitivity is required when discussing smoking history. As most patients are aware of the negative health effects, it is important to inquire whether the patient has ever smoked. Alcohol consumption leads to a wide range of health issues, including liver cirrhosis, encephalopathy, peripheral neuropathy, pancreatitis, cardiomyopathy, erectile dysfunction, and an increased risk of accidents. Healthcare professionals should always ask patients about their alcohol consumption habits. Review of systems. The review of systems is an opportunity to uncover any overlooked health problems and explore significant past events that may be unrelated to the current illness. Major health events discovered during this process should be documented appropriately. For the general system, ask about usual weight, recent weight changes, changes in clothing fit, weakness, fatigue, and fever. For dermatology, inquire about rashes, lumps, sores, itching, dryness, changes in color, hair or nails, and any changes in the size or color of moles. Ears, ask about hearing, tinnitus, vertigo, earaches, infections, and discharge. If hearing is decreased, inquire about the use or non-use of hearing aids. Eyes, explore vision, use of glasses or contact lenses, date of the last eye examination, pain, redness, excessive tearing, double or blurred vision, spots, specks, flashing lights, and any history of glaucoma or cataracts. Head, ask about headaches, head injuries, dizziness, and lightheadedness. Nose sinuses, inquire about frequent colds, nasal stuffiness, discharge, itching, hay fever, nosebleeds, and sinus trouble. Throat/mouth, explore the condition of teeth and gums, bleeding gums, dentures, the date of the last dental examination, sore tongue, dry mouth, frequent sore throats, and hoarseness. Neck, ask about swollen glands, goiter, lumps, pain, and stiffness in the neck. Breast, inquire about lumps, pain or discomfort, nipple discharge, and self-examination practices. Hematologic, explore the presence of anemia, easy bruising, easy bleeding, past transfusions, and any history of transfusion reactions. Respiratory, inquire about cough, sputum, color, quantity, presence of blood, shortness of breath, wheezing, pleuritic pain, and the date of the last chest X-ray. Cardiovascular, ask about any history of heart trouble, high blood pressure, rheumatic fever, heart murmurs, chest pain or discomfort, palpitations, shortness of breath, orthopnea, paroxysmal nocturnal dyspnea, swelling in the hands, ankles, or feet, edema, and previous cardiovascular test results. Gastrointestinal, explore trouble swallowing, heartburn, appetite, nausea, stool color and size, changes in bowel habits, pain with defecation, rectal bleeding, black or tarry stools, hemorrhoids, constipation, diarrhea, abdominal pain, food intolerance, excessive belching or passing of gas, and any history of jaundice, liver or gallbladder trouble, and hepatitis. Peripheral vascular, ask about intermittent leg pain with exertion, claudication, leg cramps, varicose veins, past clots in the veins, swelling in the calves, legs, or feet, color change in fingertips or toes during cold weather, and any swelling with redness or tenderness. Urinary, inquire about frequency of urination, polyuria, nocturia, urgency, burning or pain during urination, hematuria, urinary infections, kidney or flank pain, kidney stones, ureteral colic, suprapubic pain, incontinence, reduced urinary stream caliber or force in males, hesitancy, and dribbling. Musculoskeletal, explore muscle or joint pain, stiffness, arthritis, gout, backache, history of trauma, neck or low back pain, and joint pain accompanied by systemic symptoms such as fever, chills, rash, anorexia, weight loss, or weakness. Genital, male, ask about the presence of hernias, discharge from or sores on the penis, testicular pain or masses, scrotal pain or swelling, history of STDs and their treatments, sexual habits, condom use, and any concerns about HIV infection. Genital, female, inquire about the age at menarche, onset of menstruation, regularity, frequency, and duration of periods, amount of bleeding, bleeding between periods or after intercourse, date of the last menstrual period, presence of dysmenorrhea, painful periods, and premenstrual tension, age at menopause, menopausal symptoms, postmenopausal bleeding, vaginal discharge, itching or sores, presence of lumps, history of STIs and their treatments, number of pregnancies, type and number of deliveries, history of abortions, complications of pregnancy, birth control methods used, sexual interest, presence of dyspareunia, and any concerns about HIV infection. Psychiatric, inquire about nervousness, tension, mood swings, depression, changes in memory, presence of suicidal thoughts, suicide plans or attempts, history of counseling, psychotherapy, and psychiatric admissions. Neurologic, ask about changes in mood, attention, speech, orientation, memory, insight, or judgment. Inquire about headaches, dizziness, vertigo, fainting, blackouts, weakness, paralysis, numbness or loss of sensation, tingling or pins and needles sensations, tremors, and any other involuntary movements. Also, ask about the history of seizures. Endocrine, discuss any history of thyroid issues, heat or cold intolerance, excessive sweating, excessive thirst or hunger, increased urination, and changes in glove or shoe size. As we come to the end of this presentation, I sincerely hope that you have found it engaging and valuable for your clinical practice. The information shared today is meant to support and enhance your knowledge in this field. I trust that you have gained insights that will be beneficial in your future endeavors. Looking ahead, in our next session, we will delve into the topic of general physical examination. This will provide us with a comprehensive understanding of the various aspects involved in assessing a patient's physical health. I encourage you to join us for that session, as it promises to be informative and practical. Lastly, I would like to express my gratitude for your time and attention throughout this presentation. I kindly ask for your support in liking and subscribing to my channel if you haven't already, and I encourage you to share it with your friends. Thank you for your support and consideration. Your presence and participation have made this a meaningful experience. Take care and best of luck in your clinical practice.